Welcome to another episode of Med Madness, where we delve into important medical topics with clarity and precision. In today's episode, we'll be discussing a condition that often strikes unexpectedly and can be both frightening and debilitating: panic disorder. We'll explore its clinical features, treatment options, and how it can often be confused with other medical conditions. Stay tuned until the end, where we'll share a real-life case study that highlights the complexities of diagnosing and managing this disorder. Next, let's discuss what panic disorder is all about. Panic disorder is characterized by sudden, recurrent episodes of intense fear or discomfort that reach their peak within minutes. These episodes, known as panic attacks, can include a variety of alarming physical symptoms such as chest pain, palpitations, shortness of breath, dizziness, and even a fear of dying. What makes panic disorder particularly challenging is that these attacks are often unexpected and can occur without any obvious trigger. Let's start by breaking down the key symptoms of a panic attack. A person experiencing a panic attack might feel like they are having a heart attack, with symptoms like chest pain and a racing heart. They may also feel short of breath, like they're choking or unable to get enough air. Sweating, trembling, and a sense of impending doom are common, as is a feeling of being detached from reality, known as derealization, or from oneself, known as depersonalization. Because the symptoms of panic disorder can mimic other serious conditions, such as heart disease or respiratory disorders, it is not uncommon for patients to undergo multiple medical evaluations before a diagnosis of panic disorder is made. The key to diagnosis is recognizing the pattern of unexpected and recurrent panic attacks, along with the persistent worry about future attacks or changes in behavior designed to avoid them. Now, let's talk about treatment. The good news is that panic disorder is treatable. The first-line treatments include selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, which help reduce the frequency and severity of panic attacks. Cognitive behavioral therapy, or CBT, is also highly effective, helping patients understand the nature of their panic attacks and teaching them strategies to manage their anxiety. For those who need immediate relief from acute panic attacks, benzodiazepines can be used. However, due to the potential for dependence and addiction, these medications are typically reserved for short-term use and in patients who do not have a history of substance abuse. Now, let's look at a brief case study to illustrate these points. A 28-year-old man presents to the emergency department with chest pain, shortness of breath, and a racing heart. He's had multiple similar episodes over the past 6 months and has undergone several cardiac evaluations, all of which were normal. During his visit, he mentions that these episodes often occur out of the blue, even when he's at home relaxing. He started avoiding certain places, fearing that he might have another attack, especially if he's in a situation where he can't get help quickly. After a thorough evaluation, he is diagnosed with panic disorder. He is started on an SSRI and referred to a therapist for cognitive behavioral therapy. Over time, his symptoms improve and he learns how to manage his anxiety effectively. In summary, panic disorder is a challenging but manageable condition. It's crucial to recognize the signs early and differentiate it from other medical conditions to avoid unnecessary tests and interventions. With the right combination of medication and therapy, patients can regain control over their lives. Thank you for tuning in to this episode of Med Madness. To reinforce what you've learned today, don't forget to check out our pre- and post-podcast quizzes and explore the Anki flashcards we've created to help you master this topic. Stay curious, stay informed, and we'll see you in the next episode.